The first question is, tell me about yourself. Good morning, Madam Hiring Manager. My name is Xue Lin and you can call me Ang. I was born and raised in Malaysia. I am a graduate from University Putra, Malaysia with a degree in Doctor of Medicine. You can expect a candidate who is passionate about seeking knowledge and one who excels in her academics. In medical school, I was awarded the top 3 Best Student Award for my professional examination in the year 2017. I have had 2 years of on-the-job training as a medical officer in Hospital Serdang. I have successfully completed 2 years of hands-on training at the radiology department, performing various sonographic procedures as well as medical imaging for patients. Throughout my 2 years of training, I've been attached to a consultant sonographer who specializes in obstetrics and gynecology. During my attachment with her, I have mastered the skills to estimate the gestational period of a fetus based on fetal head circumference, body and limb lengths. Besides, I'm also able to assess the developmental status of a patient throughout all 3 trimesters of pregnancy. In addition, I've also picked up skills such as evaluation of the fetal presentation, maternal placenta, as well as amniotic fluid. So during my clinical attachment with my supervisor, whenever we came across rare clinical cases, she would encourage me to write case reports to be presented at the Biennial College of Obstetrics and Gynecology Scientific Meeting to specialists nationwide. So thus far, throughout my 2 years of training, I have presented 2 cases at nationwide conferences, one on fetal papyraceous and the second one is on intramural ectopic pregnancy. The second question is, can you please share 3 qualities that can benefit the company? One of the qualities that I have is I'm enterprising and willing to take up challenges. As a volunteer for health screening events, we need to approach various pharmaceutical companies to sponsor the medical equipment needed for these events. Some of these medical equipments include sterile latex gloves, glucometers, glucose strips, as well as alcohol swabs. So it is not easy to approach big companies to obtain sponsorship for our events. But I have worked hard and wrote letters to the companies stating the purpose and importance of these events, and thus I subsequently managed to obtain sponsorship from big companies such as Johnson & Johnson to collaborate with members of the medical society to contribute to equipments to these health screening events. Another quality that I have is good communication skills. As the Vice President of Medic Night 2016, I had to personally invite the Dean of the faculty as well as club advisors to attend this event. As a leader, I also listened diligently to the opinion of my teammates to ensure a smooth flow of pre-event preparations, walk-in flow of the guests, as well as performance flow. Another quality that I demonstrate is positive thinking. There was a time when my colleagues and I we took on a project to make an artifact for an exhibition at our faculty. Unfortunately, our submission had to be turned down by the organizers due to space constraint. However, my teammates and we took it positively, and after discussion and deliberation with our project supervisor, she agreed to display our artifact and to be put to use for teachings at the Human Anatomy Museum at our faculty. So the third question is, how do you respond when your ideas are rejected? First and foremost, I will openly accept the rejections. In things that we do in our daily life, especially when working with other people, we do not always see eye to eye when it comes to discussion and opinion giving. So if ever my ideas are rejected by others, I will diligently listen to the ideas of others and try to work on my shortcomings and weaknesses. By listening to the ideas of others, we try to see things from a different perspective, and that is how we are able to break a big problem into several pieces, and we can then get to the root of the problem to come up with solutions and solve the major issue. That's all from me. Thank you.